Let me start with something many men over 50 think about, but rarely say out loud. If you're past 50, how often should you actually ejaculate to support your prostate and overall vitality? Is there a number you're supposed to hit each week? Is more better? Is less risky? Or is that whole way of thinking missing the point? If this question has crossed your mind, you're in good company. In my practice, I hear it all the time from men in their 50s, 60s, even 70s, successful men, active men, men who take care of themselves. And yet, there's quiet uncertainty around this topic because the information online swings between extremes. One side says daily ejaculation is a miracle for your prostate. The other warns that sexual activity drains your strength or accelerates aging. Neither of those narratives serves you well. Here's what most men are never told: your prostate doesn't operate on a fixed schedule, and your vitality is not determined by a single number. Sexual health after 50 is about physiology, recovery, hormones, circulation, and intention. It's about context. I'm speaking to you as a physician who works specifically with men navigating midlife changes. I see the shifts that happen after 50. Testosterone gradually declines. Sleep can become lighter. Recovery after workouts takes longer. Erections may not be as automatic as they were at 25. The prostate itself often enlarges with age, a common condition called benign prostatic hyperplasia. That enlargement doesn't mean cancer. It's a normal part of aging for many men, but it can bring urinary changes, like weaker stream getting up more at night, or that sensation of incomplete emptying. So where does ejaculation fit into all of this? Let's start with physiology. The prostate produces a significant portion of seminal fluid when you ejaculate. That fluid is released. There is reasonable evidence suggesting that regular ejaculation may help clear inflammatory compounds and stagnant secretions from the gland. Men who ejaculate more frequently over long periods of adulthood appear to have a lower incidence of prostate cancer compared to men who ejaculate rarely. That does not mean ejaculation is a guarantee of protection, and it certainly doesn't replace screening or proper medical evaluation, but it suggests that regular release may be one supportive factor in maintaining prostate health. Now pause for a moment. Does that mean every man over 50 should aim for a specific number each month? No, that's where nuance matters. Ejaculation also increases blood flow to the pelvic region. Erections themselves are a vascular event. They depend on healthy arteries, good endothelial function, responsive nerves, and balanced hormones. When you have regular sexual activity, you are engaging that vascular network. Think of it as gentle conditioning for the pelvic floor and penile tissue in a time of life when cardiovascular risk is rising for many men. Maintaining blood flow in that region can be beneficial. But here's the key question I ask my patients: how do you feel afterward? A healthy frequency for one man might leave him feeling relaxed, clear-headed, and connected. For another man, especially if he is sleep-deprived, metabolically unhealthy, or under chronic stress, too frequent ejaculation may leave him feeling temporarily drained after 50. Hormonal recovery is not identical to what it was in your 20s. Testosterone fluctuations can feel more noticeable. Nervous system recovery can take longer. That doesn't mean you're fragile. It means you're maturing physiologically, and your body deserves respect. I had a 58-year-old patient who came in concerned that he wasn't matching what he had read online. He thought he should be ejaculating daily for prostate protection, but he was also managing high blood pressure, sleeping 5 hours a night, and carrying extra weight around his midsection. He felt fatigued and slightly irritable when we stepped back and focused on sleep resistance training, improving his metabolic markers, and creating a more balanced sexual rhythm with his partner. His energy improved, his erections improved, his urinary symptoms stabilized. The answer wasn't more, it was better aligned. On the other hand, I've seen healthy, physically active 52-year-olds with strong cardiovascular conditioning who feel excellent with frequent sexual activity. They sleep well. Their labs are solid. Their testosterone levels are appropriate for their age. Their partners are engaged. For them, higher frequency is not a stressor. It's a reflection of vitality. So instead of asking what number you should hit, ask better questions. Are you energized or depleted afterward? Is your sleep improving or disrupted? Are your urinary symptoms stable? Is your sexual behavior intentional and connected, or is it driven by stress, boredom, or anxiety? We also need to address a common myth. Some men believe that if they ejaculate regularly, they don't need to worry about prostate screening. That's not true. Regular ejaculation does not eliminate the risk of prostate cancer or advanced enlargement. If you notice persistent urinary changes, blood in the urine, pelvic discomfort, or unexplained symptoms, you need evaluation. That means lab testing when appropriate, PSA monitoring when indicated, and a conversation with your physician about your personal risk factors. Another misconception swings the opposite way. There's an idea circulating that ejaculation significantly drains testosterone or masculine energy. In healthy men, ejaculation causes short-term hormonal shifts, including changes in prolactin and other neurochemicals, but it does not cause long-term depletion of testosterone when your endocrine system is functioning normally. Chronic illness, obesity, insulin resistance, poor sleep, and sedentary behavior have far more impact on testosterone levels than moderate sexual activity. This brings us to the bigger picture. Prostate health after 50 is deeply tied to metabolic health, visceral fat, insulin resistance, chronic inflammation, alcohol overuse, and lack of movement all influence prostate growth and cancer risk. Sexual frequency cannot override poor lifestyle habits, but within a balanced lifestyle, it can be part of a healthy rhythm. If fertility is still a goal, spacing ejaculation every 2 to 3 days may optimize sperm concentration. If fertility is not a concern, then the focus shifts more toward how sexual activity integrates into your energy relationship and recovery. What about medications and supplements? Some men over 50 are on medications for blood pressure, diabetes, or cholesterol that can affect erectile quality. Others take medication specifically for prostate enlargement, which may change ejaculation, volume, or sensation. If you notice changes after starting a medication, that's a conversation to have with your doctor. There are often adjustments that can be made. As for supplements marketed for prostate cleansing or male power, be cautious. Many are poorly regulated, and few are supported by strong evidence. Your money is usually better invested in lab testing, personalized medical guidance, and lifestyle upgrades. When is treatment appropriate? If erectile dysfunction becomes persistent and distressing, if urinary symptoms interfere with sleep and quality of life, if testosterone levels are clearly low and accompanied by symptoms like fatigue, low libido, and reduced muscle mass, then structured medical evaluation is appropriate. That might include blood work, hormone panels, metabolic markers, and cardiovascular assessment. Treatment should be individualized. Sometimes lifestyle changes are enough. Sometimes medication is helpful. Occasionally, hormone therapy is considered, but only after careful evaluation and ongoing monitoring. When is treatment not necessary? If you are functioning well, your labs are stable, your urinary symptoms are mild, and your sexual rhythm feels natural and energizing, there may be nothing to fix. Aging is not a disease. Variation is not pathology. I also want to touch on the mental and emotional component. Sexual health is not just mechanical. It involves confidence, connection, stress levels, and how you view yourself as a man in this phase of life. Some men become overly focused on frequency as a measure of worth. That mindset can create pressure rather than vitality. True strength after 50 is not about proving something. It's about alignment between your physiology, your goals, and your relationships. So, what does a reasonable range look like for many healthy men over 50 in clinical experience? Moderate frequency, often a few times per week, is well tolerated and may provide the circulatory and fluid clearing benefits we discussed. But again, it is a range, not a prescription. Your body gives feedback. The goal is not to chase a statistic, it's to maintain energy recovery and connection. I encourage you to have open conversations with your healthcare provider. Ask about your testosterone levels, ask about your metabolic markers, ask whether your PSA screening schedule is appropriate for your age and risk profile. Ask how your cardiovascular health may be influencing your sexual function. Those are intelligent questions. They show ownership of your health. Let me ask you something directly. Do you feel in control of your sexual health, or do you feel confused by conflicting messages? Have you noticed changes in frequency, desire, or recovery as you've aged? I'd genuinely like to hear from you. Share your age and where you're watching from in the comments. These conversations help normalize what so many men quietly wonder about. The bottom line is this: for most men over 50, regular ejaculation is not harmful. It may offer benefits for prostate maintenance, pelvic circulation, stress regulation, and overall well-being, but more is not automatically better, and less is not automatically dangerous. The right frequency is the one that supports your energy, your recovery, your relationships, and your long-term health goals. Continue lifting weights, continue walking, continue prioritizing sleep, moderate alcohol, keep your waistline in check, get your labs done, stay engaged with your partner. Sexual health is woven into all of that. It's not separate from your cardiovascular system, your hormones, or your mental clarity. It's part of the same integrated physiology. You are not fragile after 50. You are evolving, and with the right awareness, you can maintain strength, performance, and vitality for decades to come. If this conversation brought you clarity, take a moment to like the video and subscribe. Share it with a friend who might need calm, evidence-based perspective instead of internet extremes, and in the comments, tell me what changes you've noticed in your own body as you've moved through midlife. What questions do you want answered next? Real masculine vitality isn't about chasing numbers. It's about understanding your body, making informed decisions, and living with steady confidence. I'll see you in the next conversation.